Here is your question. Right, so if you've read and understood considering the communication skills station, kindly begin.
I will enter the room. My candidate number is this. My name is Dr. Khawar, one of the surgical doctor here. May I ask your name and age, please, sir?
Yes, I am Adam. I am 65-year-old.
Okay. Sit down, Adam. Can you see the, can you know where is the chair? I can help you.
Yeah, please.
Please sit down. Do you know, do you have idea where I am standing or sitting?
Yes,
Do you
I
have
can
idea?
guess.
You can guess.
Yes.
Okay. And what about the light? Can I switch off the light? Is it
Oh,
annoying you?
thank you. Thank you. It's okay.
Uh, Alex, I
Adam.
know that. What are you saying?
Adam.
Adam, I know that your operation groin hernia is planned, and you are on tablet Warfarin due to your previous heart valve replacement. I know that you have some concern about this tablet and operation. Please tell me what are the issues.
Yes, doctor, you're right. I have a operation for my heart valve. So my doctor gave me a one medicine called Warfarin, which he told never to stop. That's why I'm worried. If you stop it, so
Uh,
what are
I,
you
uh,
going to do about it?
I understand your apprehensions, but Adam, first of all, I want to tell you what is the tablet warfarin. Warfarin is a
Yes,
medicine that will thin your blood. It is a blood thinning drug. And as you already know that you have heart valve uh, replacement. And due to this artificial valve, blood can clot on it. You understand? And
yes,
warfarin is
okay.
given to stop and prevent this blood clot formation on your. It acts as a thinning effect on the blood. So we have this, and you have all. Also planning to do your groin hernia operation, and if we continue this warfarin tablet, its blood thinning effect can cause difficulty for operation, and it cause bleeding. So we decided to stop this tablet warfarin 5 days before your operation and start injection heparin, the another blood thinning drug.
So on this heparin will cause bleeding, doctor?
Heparin can cause bleeding, but the advantage of injection heparin is that we can stop 12 hours before the operation, and we will admit you and 5 days before, and we will start injection heparin. Heparin is also the same effect, but the advantage is that it can be stopped 12 hours. So in 12 hours period, the effects of blood thinning effects of the heparin will be finished, and we can safely perform your operation without any risk of bleeding. Because in your groin hernia repair, there may be bleeding uh, can occur if we continue these blood thinning medications. You understand what
So,
I am saying?
yes, doctor. So are you saying that these two medicine acts in the same way?
Their ways are different. They produce different, act on different chemicals on the blood, but their effects are the same. But the main advantages is that the heparin can be stopped in short duration. Warfarin cannot stop. Its effect is long, and we have to stop 5 days before. And heparin can be stopped 12 days before. That is the advantage. Because with
Doctor,
warfarin, we cannot operate you
okay,
if
doctor,
you are only.
I do one blood test called INR every month, which my doctor surgeon asks to do every month and keep it within 2 to 3. So how are you going to manage this?
Actually, we will, the heparin laboratory test is different. And we will monitor with that categories and lab test values. And its monitoring is not the INR, it is different. And it is called PT, but I think so that you may not understand what is the PT test, but it is different test. So we will monitor according to it. And its value is different. It is seconds. We will keep it on 40 to 60 seconds, but it is the laboratory value. So we are not, it is difficult to understand for most of the people.
So can I give this injection heparin at my home, or do I need to admit in the hospital?
Yes, you need to be admitted in the hospital because we will monitor with the different lab value, and constant monitoring is required because we do not want that more blood thinning effect will go by this heparin. So we will reduce or increase the dose of heparin according to lab values. So the appropriate blood level of the heparin should be in the blood. Which is
Will you give it through my veins, or it just under the skin, like insulin?
There are both ways, but during operation, we will give injection heparin in your veins because it is easy to stop this intravenous heparin. And its effects is also finish within 12 hours. And if, God forbid, something happened to your blood that it is more thin, then there is a medicine which is against the heparin, and it is against the heparin which is given by IV, intravenous, not the beneath the skin.
Okay, so when are you going to restart my warfarin?
It will be start after the operation 6 to 12 hours, but it mostly depends on your lab values, that either there is no threat of bleeding and your operation has gone smoothly, and we will start after that, that there is no threat of bleeding problems. Then we will start injection heparin again, 6 to 12 hours.
Okay. So can I take my regular medications during this period?
Yes, you can take your medication. Can I ask which type of medication are you taking?
I take a diazepam for my sleeping problem.
Yes, you can take in the morning of the operation, 2 hours before the operation, with the small sips of water. I want to add one thing, that your tablet warfarin will also be start after the operation, but we will adjust the blood levels that there is not harmful, and we will overlap your warfarin with the heparin, and then we will stop heparin and start continue tablet warfarin according to laboratory reports. Do you understand?
Yes.
Anything else do you want to ask me?
Would I have to stay at hospital all these days, doctor?
Yeah, can't I give this at my home with if you can arrange it, it would be better for me.
Yes, then I have to coordinate your general practitioner, local general practitioner, and the nurse, concerned nurse, and we can give if you have difficulty.
Social services.
Social services.
Why?
Yes, social.
Patient is blind. Yes.
Yes,
Next.
social
Yes.
services.
Yes.
And let's summarize, Mr. Adam, that your operation of groin hernia is planned after a few days, and we have decided to stop your tablet warfarin as it will be difficult for us to operate with this medication, and we will start injection heparin. And I will tell you all the things regarding the heparin, regarding hospital admission and restart of the tablet warfarin. And on your wish, we can give this medication injection at your home with the help of our staff and doctors and social workers. Anything else you want to ask, you can ask me. We all are here to help you and to dive your hand at any time. I will leave my number to the emergency nurse and you can contact me at any time. Thank you for understanding.
Good.
Thank you, Doctor.
Okay. Feedback, please.
Yes, it was quite brilliant, Dr. Kawar. You answered all the questions, and I think that was pretty much good.
Sometimes I felt he was using medical jargon instead
Yeah,
of,
a few
yes.
medical terms.
So he needs to practice explaining all in a layman language. And at the end, somebody should be brief, 20 seconds, 30 seconds, not more than that. So he struggles to summarize the station as well, which means he hasn't done enough practice. So these are my concerns.
Yes, madam.
Yeah. So
which medical terms, madam, do you pick?
Yes, many. Because when you were explaining the procedure, you were using PT, and then you said you won't understand. Like if you're mentioning it, then explain it. Otherwise,
Okay.
do not mention anything which you are not willing to explain. Because in this way, it seems that you are giving half message. So in the exam, you're not going to give half message and leave the patient confused with the rest. So if you use something, then explain it, express it, and in a very layman language. Or if you are not, otherwise do not use it. And in this one as well, you can explain that, okay, that's how, because patient asked you, if they both work in the same way, then you can explain how the warfarin acts. Maybe you can get the paper and pen out of your pocket and start drawing. Okay, this is how it works. That's, you take it from mouth and then it goes to the liver and this is what happens. Just show it. And then what are the effects which are bothering you as a physician, and because you have to operate on the patient. And whereas this heparin, the other injectable form of medication which you are going to give to the patient, how that acts, what is their mode of action, how it will be given, what small dose will be given, how exactly everything in a smooth and proper format. If you tell the patient, explain it in your simple language, then patient would understand. While you're drawing and you're explaining, at the same time, it will help you as a candidate.
Madam, patient is blind. I cannot
I know.
draw.
Your patient is blind. I know. You can't, but still you're.
Yes, I understand.
Examiner would say
Exam.
that, okay, he's making an effort, because these blind people, they are blind, but they are not that blind that they cannot see that you're trying to show them something or you're making an effort. I know. Even if you say, okay, I'll make an effort, I'll show them. Because verbally, if you're saying it, only it's you and then the examiner also sitting there and observing that you're making an effort. Even if effort is pathetic, still you're making an effort.
Yes, madam. Yes, you're right.
Yeah, and in the beginning, when you're greeting, okay, everything that you ask to the patient should sound natural. It seems that because English is not your language, you're trying to act, so that kind of gives an impression that you're trying to act it out instead of sounding natural. That's one.
Yeah, that's correct. That's the main reason. Yes.
Yeah, that you have to practice, so that in everyday life, how you are greeting your patient, it should sound normal, exactly like that.
Yeah, that's
Good.
good.
Thanks.